welcome back to this playlist on this video lecture, Communicable and Infectious Diseases. So, on this video lecture series, or this video lecture, we are going to start presenting some discussions on the different communicable and infectious diseases. Again, a reminder, this is only an additional resource. It's always better to go back on your books, teachers, and read read as many books as you can, and always keep notes, okay, and study them again and again. So for this video lecture, we are going to present uh, tuberculosis. Okay, and before I continue, again, please subscribe to the channel, like it, share it, and hopefully you follow this for many more video lectures all about nursing and education or teaching, and also inspirational ones, okay? Inspirational videos. So we're going to discuss tuberculosis or TB in our language, and this is a chronic disease that is usually involving the lungs, but may also disseminate in other parts of the body, like the bones and blood and other parts, characterized by formation of tubercles, which tend to undergo cessation or cassation, or necrosis or fibrosis and calcification. And this is considered to be one of the deadliest infectious diseases, especially during the 1800s. And these are promotional materials during those times. Okay. So, if we have the COVID-19 now, this has been also the disease, one of the deadliest disease before. Okay, so there were many promotional materials to protect and to prevent people from having tuberculosis, even children. Okay, so this is 1952 uh, material or streamer. So again, it's one of the world's, if not the world's deadliest disease, and remains to be a major public health concern. And it was discovered, or yes, who uh, studied the illness, especially the causative agent, TB bacterium in 1882. Robert Koch is a German um, microbiologist and also a physician. Okay, so it was named after him. So alternate names are Koch's disease, thesis, galloping consumption disease, or PTB or TB. PTB refers to pulmonary tuberculosis. So causative agents are usually Mycobacterium tuberculosis and Mycobacterium bovis. So if you want to study on the causative agents, I suggest that you also go back to your microbiology lectures. So MTB or Mycobacterium tuberculosis is an acid-fast microorganism. Usually it is on the sputum of persons with TB or infected persons is the usual source, okay, of the microorganism. So mode of transmission is airborne droplet method through coughing or sneezing. May I just remind you that this data or information usually is, especially numbers, incubation periods, period of communicability, um, varies from reference to reference. So I advise you to choose the best ones or remember some of these numbers, And when you encounter this on examination, yes, well, advice to us is choose the nearest one. But especially in nursing examinations, all choices, all options seems correct. Okay, so that's why the instruction would say choose the best answer. Okay. For bovis, drinking cow's milk as unpasteurized uh, milk containing the bacteria can cause infection, especially extra pulmonary tuberculosis. So some related factors, uh, those people who are in impoverished situations, overcrowded places, people who have energy protein malnutrition. So generally, people who are malnourished, especially undernourished, is having higher risk. Have deficiencies on nutrition like vitamin A, D, and C, presence of debilitating diseases or your comorbidities, especially if the disease is causing you to be immunosuppressed, you are high risk for these infections, and usually children below 5 years old due to inadequate level of immunity. Okay, so um, it's better also to protect this age group, especially the under 5 children, because this age group in the general population has lots of health problems in terms of morbidity and also mortality. Okay, and that's why in the Philippines we have this. Also, I think in the other countries also have these under 5 children programs or under 5 clinics. Okay. And in terms of children, when we talk about tuberculosis, it is in theory, in principle, that if a child have coccidiosis or TB, it is usually attributed to transmission from an adult, okay, to the child, not child-to-child transmission. Okay. So the incubation period here, what will I present? But there are books, references that I've seen, 2 to 10 weeks. But what I'll be presenting in this presentation is 4 to 6 weeks to develop after the initial contact. Um, the period of communicability of tuberculosis, it can stay lifetime if untreated. Okay, lifetime if untreated. So I'll be focusing more later on treatment. Initial symptom is typically asymptomatic, so but it sensitizes the body tissues to the tubercle protein as evidenced by a positive tuberculin reaction. So that is one of the diagnosis or diagnostic procedures for tuberculosis, which I'll also be presenting later. Okay. So the infection of the lungs is caused by the bacteria, as we have mentioned earlier, is usually referred to a tubercle bacillus and can be communicated to others by means of droplet formation, and you may or other people may inhale it, ingest or inoculate in open cuts or wounds, okay, or your skin, your mucosa. Okay, and again, predisposing factor, just to emphasize, include debilitating diseases such as alcoholism, cardiovascular diseases, HIV, cancer, DM, and liver cirrhosis, as well as nutrition and crowded living conditions. But all uh, these predisposing factors are not limited to these ones only. Okay, so when you say tubercles, these are nodules that contain caseous necrosis, which forms in the lungs, and it will be present as lesions upon X-ray, and what's this? Granulomas also form in the infected tissue and also undergo necrosis. Okay, and tubercles are also known as tuberculous nodules or tuberculomas. Okay, tuberculous nodules or tuberculomas. Then this is one of the problems of the disease, the emergence of multi-drug resistant tuberculosis, especially if the treatment regimen is not followed properly. Okay? And it can be, it's a chronic, progressive, and reinfection phase can occur. Um, it is usually encountered in adults, and the activation of the lesion after months or years of latency can occur. Okay? It can occur. But I will be presented at 2 weeks of religiously, okay, taking in the drug or um, being obedient in the treatment regimen can increase the chances of non-communicable state. Okay, one reference would say that swallowing infected sputum may lead to laryngeal, oropharyngeal, and intestinal tuberculosis. Okay, but I suggest also that it's nice to compare one reference to another as a point of discussion. Person may contact pulmonary tuberculosis from inhaling droplets from a cough or sneeze by an infected person. Okay, remember the word always is infected person, contaminated materials. Okay, because not all people have TB, not all people are infected, not all objects are contaminated. Okay, some of the manifestations for the subjective ones, we have body malaise or weakness, pleuritic pain, easily fatigability, or easy fatigability rather, and for the objective ones, fever for 2 weeks, usually low-grade fever, and usually happens in the afternoon, followed by night sweats, cough for 2 weeks, hemoptysis or blood-streaked sputum, weight loss, chest x-ray examination is having lesions, and analysis of sputum and gastric contents shows acid fast bacilli. So usually cough for 2 weeks, especially mucoid. Okay, usually mucoid sputum is one of the first symptoms. Okay, and I'm emphasizing low-grade fever because that's a characteristic of the fever in tuberculosis. And when suddenly it becomes high-grade fever, it may indicate other problems. So you check also on the vital signs, especially temperature, okay, body temperature. Um, yes, so we're with the diagnostic procedures. Um, One of the screening tests, but not to confirm that you have tuberculosis, is MANTO test, okay, which is frequently involving the use of purified protein derivative, and PPD is injected intradermally uh, with an induration of 8 millimeters, or the will, induration or will, 8 millimeters or greater, so is usually present 48 to 72 hours later indicates a positive finding. Okay, so an increase in the duration or will um, of 8 millimeters or greater can indicate a positive finding, meaning you have been exposed to the bacteria or to the disease, but it does not confirm that you have the disease. Confirmatory is your direct sputum smear microscopy or your sputum exam. Okay, so I'll be discussing maybe in another video lecture the way on how to collect a sputum exam. Okay, the point here is you are going the patient, the suspected patient um, will uh, should submit um, samples of his or her sputum and to be studied under microscope and to look if there is presence of that bacilli. Okay, then that will confirm. That's a confirmatory, meaning that would really tell you if you have the TB disease or not. How about chest X-ray? Chest X-ray is for complementary diagnostic procedure to see if you have the presence of the lesions. If maybe it would also tell you if uh, uh, if you have the disease and how long already you have the disease, or how severe the disease is already in your lungs. Okay, so again, confirmatory is sputum, screening is MAN2, okay, or tuberculin testing, and um, for severity, okay, or adjunct therapy or diagnostic procedure is your chest X-ray. Okay, then culture and sensitivity, it's I think it can be really done now because of the many emerging studies, uh, especially when it comes to medications. Um, culture and sensitivity usually is done for diseases who or which has uncertain causative agents. Okay? Although there are some physicians still, or most physicians still, who go for culture and sensitivity. Okay? This is to identify the causative agent and to know which drug is more effective. So, okay, this is all about the tuberculin testing or the MANTO testing. If the induration increases 5 millimeters or more, it is positive in HIV positive person for the immunocompromised persons. Although what I've mentioned earlier in the previous slide is 8 millimeters, but this is a additional condition. If the person is HIV positive or immunocompromised, 5 millimeters or more is already considered positive. Okay? Recent contacts of active tuberculosis cases, persons with nodular or fibrotic changes on chest X-ray, consistent with old healed TB, organ transplant recipients, and other immunosuppressed persons, patients on long-term systemic corticosteroid therapy, because it also lowers your immune system. The treatment regimen with steroids, okay, especially prednisone. Then end-stage renal diseases. So for those having ESRD cases or related to kidneys, okay, end-stage renal diseases. Then for 10 millimeters or more is positive in persons who have who came from high prevalence countries, less than 5 years, especially the tropical areas. Philippines is one. You can be positive with it. People who engage with injectable drug users, who are injectable drug users, residents and employees of high risk places, again, mycobacteriology, lab personnel, exposure to the microorganism, persons with clinical conditions that place them at high risk, for example, diabetic people, people under steroid therapy, uh, leukemic status, and stage renal disease, again, chronic malabsorption syndromes, low body weight, and the like. And children less than 4 years of age, or children and adolescents exposed to adults in high risk category braces, infants, children, adolescents exposed to adults in high risk categories. Okay, so as I mentioned earlier, it's usually adult to child transmission. Okay, so we are here in the 15 millimeter or more is positive in persons with no known risk factors for TB, or these are the healthy ones. Okay, and reactions larger than 15 millimeters are likely to be due to previous BCG vaccination or exposure to environmental mycobacteria. So, uh, if you have received your BCG vaccination, there's a high tendency, or there's a tendency, if that's high, uh, to have a positive result in your MANTO test. Okay? If the infection is very high, the PBD test need not to be repeated. Okay? Um, the positive PPD test is usually followed by TB symptom assessment, physical exam, and chest radiograph to confirm if you really have the disease. Okay? If there are no symptoms of TB and no evidence of active tuberculosis infection, um, uh, on physical exam and x-ray, the patient most likely has latent tuberculosis. And the treatment of latent tuberculosis should be encouraged also once it's detected. However, if the evaluation or the chest x-ray is positive, additional tests may also be done to confirm the diagnosis, which is your direct sputum smear microscopy. Okay? And this can be other tests aside from sputum test is urine test, tissue biopsy, and the like. And it depends on the protocols. Okay, so in management, in managing tuberculosis, we usually have this in the Philippines. Okay, in the Philippine setting, we have this DOTS, or your direct observed treatment scheme, or direct observed treatment short course, usually averaging of 6 months. This is highly emphasized by the Department of Health Philippines. This is a standard regimen um, for the treatment in persons with tuberculosis. And it's a multi-drug approach, okay, multi-drug therapy approach, because it is believed that the drugs potentiate one another, and one of the reasons of multi-drug therapy approach is to reduce development of resistant strains of the bacteria. Okay, so that's why it is um, really emphasized to follow the proper treatment regimen. Okay, um, if it's for 6 months every day, it should be done every 6 months every day. That's why it's said to be directly observed, because there must be someone watching you or monitoring you, uh, or the person taking the drug, okay, or reminding you that's medication time. Okay? So direct observation of drug administration or taking the drug is very, very important. Let me focus on the National Tuberculosis Control Program in the Philippines. The vision here, this came from DOH Philippines site. The vision is a country where TB is no longer a public health problem. The mission is ensure that TB DATS services are available to the communities in the Philippines. And the goal is to reduce the prevalence and mortality from tuberculosis um, by half by the year 2050. So the National Tuberculosis Control Program targets to cure at least 85% of sputum smear positive TB patients discovered, detect at least 70% of the estimated new sputum smear positive TB cases. And the management, as I mentioned, is your dots. It can be a short course, it can be a long course. Short course is 6 to 9 months, long course is 9 to 12 months. Okay, so about a year. And 2 weeks of why am I emphasizing religiously following treatment regimen, because 2 weeks after medications, the person can be considered non-communicable already. Okay, and I mentioned the sputum sample submission. Usually it's at least three samples that you need to submit. Um, three successive sputum is okay. Three negative sputum is non-communicable already, and these are the recommended treatment regimen for adults and children. We have here a matrix, okay, and presentation of different categories of tuberculosis. And before we proceed to that, these are the medications with this legend because we're going to use legends. So R is for rifampicin, I is for isoniazid, E for ethambutol, Z for pyrazinamide, S for streptomycin, and other medications related are KM or kanamycin, LFX for levofloxacin, PTO for pothionamide, and C for cycloserine. And the first five are the mainstay of the treatment regimen. Okay, the rifampicin, isoniazid, and ethambutol, pyrazinamide, and streptomycin. Okay, some teachers would say acronym is PRICE, or others would say um, RIPES. Okay, so um, it's up to you, whatever acronym you want to follow to remember, okay, the drugs. But much more than the acronym or the concept behind this medication. So let's start with the categories of treatment. Okay? Category 1 patients are those cases with pulmonary tuberculosis which knew whether bacteriological confirmation was done or clinically diagnosed. Extrapulmonary tuberculosis, meaning tuberculosis outside the lungs, it's like TB of the bones, TB of the blood, and others. And new, okay, except CNS or bones or joints tuberculosis cases. So, new whether bacteriologically confirmed or clinically diagnosed. So, the treatment regimen here is 2 months of your HRZE and 4 months of HR. Okay. The second part is for maintenance purposes. Okay. Then category 1A, so there's category 1, there's category 1A. Be careful with the reference because I think most of the reference would still present the old treatment regimen for tuberculosis. So before there's only 1, 2, and 3, then 1, 2, 3, and 4. Now we have category 1, 1A. Okay. So category 1A patients are patients who have extrapulmonary tuberculosis and new cases of tuberculosis related to CNS, bones, or joints. Okay, the treatment regimen here is 2 months of HRZE treatment and 10 months of HR. Okay, so you get this with the legend that I presented earlier. Okay, again, this is coming from the DOH source. Then category 2, classification and registration group are people who have pulmonary or extrapulmonary tuberculosis, which are previously treated um, uh, and what's this? Sorry, previously treated drug susceptible tuberculosis, whether bacteriologically confirmed or clinically diagnosed. So they already have the disease before, then it was treated, then possibly is they have relapse. Okay, they have relapse of the disease. The treatment is a failure because let's say treatment regimen was not properly followed. Treatment after loss to follow up, is also under category 2. Previous treatment outcome is unknown, and other reasons. Treatment regimen here is uh, 2 months of the whole mainstay, and 1 month and another 5 months for HRE. Then we have category 2A, extrapulmonary cases, previously treated drug-susceptible TB, whether bacteriologically confirmed or clinically diagnosed, CNS or bones or joints. Okay, and that is the treatment regimen. We're talking about months here. Okay, 2 months, 1 month, and 9 months. The next is standard regimen drug resistant category. These are usually for people with resistance or people having microorganisms with resistance already. For example, rifampicin resistant tuberculosis or multi-drug resistant tuberculosis. As I mentioned earlier, this is one of the concerns in relation to TB treatment. The the strains of bacteria have the capacity to be resistant. Okay, so individualized ones, DST result is available. Treatment duration for at least 18 months. Then another category, XDRs, TB regimen. Okay, the classification and registration group are for those extensively drug-resistant tuberculosis cases. Again, this is individualized, so it depends on the severity and depends on the history of previous treatment. Now, one important concept here in tuberculosis are the drugs and their side effects. This will be presented in a table format. Okay, so on the first column, we have the adverse effects. Second are the drugs which can produce these adverse effects and the management. Okay, so first we have the minor adverse reactions, gastrointestinal intolerance. So the um, patient may experience gastric problems. Rifampicin, isoniazid, pyrazinamide are the drugs that can cause GI problems. So give the drugs at bedtime or with small meals, okay, to prevent it. Mild or localized skin reactions, any type of the drugs mentioned earlier, give antihistamines. Okay. For rifampicin, this is a very common question, produces orange or red colored urine or secretions. And management here is to reassure the patient that it happens because of the drug, okay, and it will disappear after the treatment regimen or after taking the drug. Okay, then streptomycin, which is injectable, among the four mainstay drugs, this is the only injectable drug, and the other drugs are oral. Okay, um, pain at the injection site, apply warm compress, and rotate the sites of injection. Then other minor uh, adverse reactions. Number 5, burning sensation in the feet due to peripheral neuropathy. This is common to isoniazid, and the management here is to give pyridoxine or vitamin B6 50 to 100 milligrams daily for treatment or 10 milligrams daily for prevention, because the use of isoniazid usually leads to vitamin B6 depletion, and the depletion of vitamin B6 leads to neurotoxic effects, okay, like neuropathy, okay, especially on the fingers and toes, tingling sensations can be experienced. Then for pyrazinamide, arthralgia due to increased uric acid, okay, hyperuricemia. So give aspirin or NSAIDs if symptoms persist, okay. consider gout and request for blood chemistry, okay, to confirm and manage accordingly. It's good to consult your physician. Then one minor uh, adverse reaction are flu-like symptoms, like manifestations of fever, muscle pains, inflammation of the respiratory tract. Um, this is because of rifampicin. Give antipyretics. Okay, so in the minor adverse reactions, as you can observe, there's no special treatment needed. Okay, but aside from the minor adverse reactions, there are also major adverse reactions to look into, to be watched out for, to be reported. Okay, so severe skin rash due to hypersensitivity. This is brought about by any kind of those diseases of those drugs, especially streptomycin, which is injectable. Okay, so management is to discontinue the anti-TB drug and refer to appropriate specialists. Then second, jaundice due to hepatitis or liver toxicity or liver damage. Okay, so any kind of those drugs, especially isoniazid, rifampicin, and pyrazinamide, discontinue the drug. So always check for signs of jaundice. Okay, and if symptoms subside, resume treatment and monitor clinically. So you should always teach the patient, the family to look for signs of the adverse reactions. Okay, and you they must also know if it's a major adverse reaction or minor adverse reaction. Okay. Then third is impairment of visual acuity and color vision due to optic neuritis. Okay, and one is this is caused by ethambutol, so letter E, eye problems, also E and E. Okay, to remember it. Okay, so discontinue the drug, then refer to an ophthalmologist. Okay, for streptomycin, the ears are affected here, hearing impairment, ringing of the ears or your tinnitus, and dizziness due to damage of the eight cranial nerves both for hearing and balance. And discontinue the drug and also refer to specialists. Then fifth is oliguria or albuminuria due to renal disorder. Okay, so this can be um, toxic to the kidneys, nephrotoxic. Okay, if one is jaundice, which is your hepatotoxicity, you also have nephrotoxicity. Okay, one is affecting the liver and the other one is affecting the kidneys. And you know that in your pharmacology that these drugs really can have an effect to these organs. Okay. Uh, Oliguria, albuminuria is caused by streptomycin or rifampicin. Discontinue the anti-TB drug, again, refer to specialists. Psychosis, okay, so and convulsion. So this affects your neuro system already. This is brought by isoniazid. Discontinue the drug and refer to proper specialists. Then we have also rifampicin because of the problems, okay, being brought about this drug. Okay, I think I have a typo error here, but I'll be putting it in my comment section or in my description section for the correction. And just showing some radiographs here. And I'm using EDM images. Complications, uh, empyema, pus, presence of pus, um, bronchopleural fistula, pastisis, especially if it's extrapulmonary. Sorry, but I will not be focusing more on the explanation of these complications. Then meningitis, hematuria, osteomyelitis, pericarditis, bronchiectasis, pneumonia, headache. But if you want to study this diseases, I suggest that you look to other resources also. I'll be presenting these diseases separately. Okay? So nursing care is more of isolation, and aside from the main nursing care is the support in the treatment regimen, and usually also symptomatic or supportive care. Okay? And it is important to know isolation protocols here, especially if the clients still have positive sputum smear or positive presence of those tubercles, those bacilli in the sputum. Okay, and health education is very important, especially hygiene and um, isolation protocols. Okay, respiratory precautionary measures also. And in terms of mask, actually, the infected person should be the one wearing the mask. Is highly advised, okay, that TB patients should wear mask so as not to communicate or transmit the disease to others. Okay, so that is our presentation, simple presentation on tuberculosis, especially pulmonary tuberculosis. Okay, so do not forget to like, subscribe, share, and comment on whatever you want to add in this video lecture. And I thank you, and God bless future nurses.